I'm Vinita Puri and I'm president of the Asia Pacific Burn Association. The APBA is honored to be a part of World Burns Week, which is to be celebrated from 4th November to 10th November. The Asia Pacific Burn Association is dedicated towards burn care in this whole region, which also includes some of those countries which have the largest burn burden in the world. With collaboration and educational initiatives, the Asia Pacific Burn Association works towards empowerment of the first responders of burn care as well as improving the burn knowledge of those who can provide advanced burn care. I hope that many organizations in our region and across the world share the vision of the World Burns Week to help reduce the burn burden across the world. I look forward to everyone joining the virtual programs of the World Burns Week between 4th November and 10th November and also contributing in their own way towards World Burns Week. Thank you and bye-bye.
En nuestros países hay un número importante de pacientes quemados que van en aumento. Sobre todo son niños que se queman en el hogar. Todas las quemaduras son eventos totalmente prevenibles. Es sumamente interesante esta primera Semana Mundial de Prevención de Quemaduras y debemos darle el valor que merita. Desde Ibero Latinoamérica nos comprometemos a dar el mayor de nuestros esfuerzos para que esta Semana Mundial de Prevención de Quemaduras sea un éxito total.
Hello, I'm Dr. Shamala Disnaga, President of the American Burn Association. At the ABA, we are honored to join World Burns Week with 10 other partner organizations to be celebrated November 4th through the 10th. The ABA is dedicated to improving the lives of everyone affected by burn injury. We have over 2,800 members worldwide, and these include firefighters, nurses, therapists, and physicians. Together, we're working to advance research, burn care, quality, and prevention. World Burns Week is a vital effort in this endeavor. Burns are a global health challenge, and it especially affects people in low and middle income countries. We are excited to support this initiative and work toward the vision of a world where burn care, state-of-the-art burn care, is accessible to everyone. The ABA is committed to raising awareness and promoting equity in burn care. Please be sure to check out the World Burn Week webinar series, which will kick off this November. Our members are actively participating in this initiative by sharing knowledge and resources to make a real impact on burn prevention worldwide, as well as quality burn care and support for survivors. Thank you very much for supporting this important cause. Together, we can create a brighter future for everyone affected by burns.
Hi, I'm Tina Baetz, CEO of Interburns, the International Network for Training, Education, and Research in Burns. It is an honor to speak to you as a member of the steering committee for the first World Burns Week, which will be held between the 4th and the 8th of November. Since 2006, Interburns has dedicated itself to working with and for healthcare workers, nurses, surgeons, therapists, nutritionists, and psychologists. From low resource and complex settings, we aim to improve the quality of burn care and prevention and help to build sustainable burn services. Burns are complex, very complex, one could say, and perhaps this is a reason why they're consistently overlooked and continue to be a major global public health crisis, a hidden one, I would say. They're overlooked by governments, by organizations, and of course by funders. Burns affect the individual, patient, healthcare worker, and survival, but also they affect families, futures, their finances, and they profoundly affect the health system and services as well. Burns are very unique, but huge advances have been made in high-income settings, and we believe that it is possible and necessary to make sure that happens around the world through partnerships, commitment, advocacy, and advance-based initiatives. It is vital for us to focus on low-resource settings, where the need is the greatest and the biggest imbalance, and it's important to improve the quality of prevention, care, and survivorship. we at Interburns wholeheartedly support World Burns Week this November and urge everyone to get involved, whether that's at a local, international, national level. Just participate. No action is too small. Put up a poster, organize a run, lobby for change. Just get involved to help shine a light on this hidden crisis. Thank you.
Dear all, I'm Stian Almond, President of the European Burns Association. I'm honored to stand with you during World Burns Week. Burns affect millions globally every year, yet many still face barriers to life-saving care due to limited resources and awareness. We in the European Burns Association believe that everyone, no matter who you are and where you are, should experience well-placed burn prevention and have access to timely treatment and rehabilitation. World Burns Week reminds us to unite as a global community. Together with patients, advocacy groups, and organizations, we can raise awareness and collaboration and ensure that every survivor gets the care they need to recover and thrive. Thank you.
Hi, I'm Jeff Gallinet. I'm a burn survivor of over 45 years, and I'm currently serving as the board president of the Phoenix Society for Burn Survivors. Our nonprofit has been providing programs and services for those who've been living with burn injuries now for nearly 50 years. So we've served thousands of burn survivors and those who care for them, and we know the many, many stories about the deep impacts of burn trauma. The social stigma, emotional trauma, and lost engagement in work, school, and society are all truly significant issues that we need to take away from the shadows. And we all need to work together to elevate the understanding of these impacts globally. We also know very well that with increased investments in quality burn care, physical and emotional rehabilitation, and community support, many, many more burn survivors can and will thrive. So we in the Phoenix Society are very honored to join the 10 other organizations launching the inaugural World Burn Week this November 4th through 10th, and we enthusiastically will invite others to join this effort. So let's all go and join together to increase awareness of both the injury crisis and then also to highlight the need for investment in prevention strategies and quality care for everyone who's impacted, regardless of where they live, and especially for those in countries where the need is the greatest. Together, we can all help to build a safer world and one where burn survivors not only heal, but they thrive. Thanks very much.
Et merci de participer à cette réunion de lancement de World Burn Week. Je parle au nom du MBC qui a été créé il y a plus de 30 ans maintenant, avec des personnes de pays favorisés et moins favorisés, dans le but de partager les connaissances sur la brûlologie. Il développe régulièrement des cours spéciaux sur la demande de personnes souvent des pays moins favorisés pour développer ce qui peut se faire dans les pays favorisés et en échangeant avec eux, voir comment eux ils peuvent adapter ces préconisations de telle manière à diminuer les différences de prise en charge entre les pays riches et les pays pauvres. Raison pour laquelle le World Burn Week est extrêmement important du point de vue du MBC. Et le MBC continuera ses actions dans ce sens. Merci.
I'm Dr. Francois Stapelberg, President of the Australian and New Zealand Burn Association. As burn clinicians, we are well aware of the risks that burn injuries pose to our patients, their families and their communities. We're also aware of the risks burn disasters pose, both natural and geopolitical conflict. Within Australia and New Zealand, we focus a lot of effort on burn prevention programs, including cooling the burn and trying to reach our vulnerable populations, including Aboriginal, Maori and immigrant communities. We also focus a lot of effort on burn education in terms of caring for the patient who's had a burn injury. One example of this is our Emergency Management of Severe Burns program that's presented not only in Australia and New Zealand, but the neighbouring Pacific countries, as well as under licence in several countries in Europe. During this World Burn Week, we'd like to lend our support to all the burn societies around the world to try and lift the veil on the risks that the hidden burn epidemic poses to all of our patients and our communities. Greetings. Thank you from the Australian-New Zealand Burn Association.
Hello, I'm David Harrington. I'm a burn surgeon from the United States and the current president of the International Society for Burn Injury. We are excited about World Burn Week and the recognition and attention that this week will bring to our cause. The existence of this week shows what partnership and advocacy can do and can accomplish, and we want to thank all the societies and institutions that have lent a hand to make this week possible. And keeping with the ISBI mission to improve burn care throughout the world, we are launching a program in 2025 to visit burn centers in low and middle resource countries throughout the world to see if we can help provide a pathway for improvement of burn care in their burn centers and in their communities. We hope that this advocacy will improve burn care throughout the world. Using this week as a stepping stone, let's improve the outcomes for burn injuries throughout the world together.
Hello, my name is Claudio Tanca, and I am the Executive Director of the Global Alliance for Surgical, Obstetric, Trauma, and Anesthesia Care. Around the world, it is estimated that 2/3 of people lack access to emergency and essential surgical and anesthesia care when needed. These disparities are most significant in low and middle-income countries, where 9 out of 10 people cannot reach or afford quality and timely care. These inequities are reflected in the burden of burns, with disproportionate injury and disability affecting people in the poorest country, in large part due to inaccessible or under-resourced system for surgical care. The 2024 theme of the World Burns Week highlights a critical message. Burn injuries are a global health crisis that needs the world's attention, and burn patients and survivors represent some of the most neglected surgical patients. We need to work together toward global equity to generate better data, increase political prioritization, and ensure that robust resources are allocated to the full spectrum of care, from prevention to treatment, rehabilitation, and survivorship. That is why I am proud that the G4 Alliance is a supporting partner of the first ever World Burns Week. Thank you for joining us today.